WYPL TV 18 presents Health Matters with Dr. Mark Castelaw, sponsored by Baptist Medical Group. BMG is our area's leading multi-specialty physician practice, with more than 500 physicians representing 40 specialties in the Mid-South. They provide a comprehensive range of care for all ages. Whether you need a family doctor, a pediatrician, heart surgeon, or cancer care, BMG gives you access to the most trusted doctors and nurses in our region. More information on Baptist Medical Group can be found online at www.baptistdoctors.org or at 901-227-DOCS to determine the best provider for your healthcare needs. Baptist Medical Group. Get better.
Thank you for joining us on this month's edition of Health Matters. I'm Dr. Mark Castelaw. Did you know that cancer is a very devastating illness and that 1 in 4 people in the United States are diagnosed with cancer? And unfortunately, 1.6 million people die from cancer in the United States. So we need to be more proactive in prevention and screening for cancer. In today's program, we're going to talk about 2 specific screening tests, colonoscopies and mammograms, to try to help educate you about these tests and to find out when they're indicated. We're going to have specialists on the show, and we're going to have patients that have undergone these procedures to explain their experience. So I hope this will be a very educational show to you. We will try to answer any questions that you have about these screening procedures, and remember, your health matters. Our first guest today on Health Matters is Dr. Stephen Edge. Our program today is about cancer and cancer screening. Dr. Edge is the president of BMG Oncology Division, and he's the director of the Baptist Cancer Center. Welcome, Dr. Edge.
Well, thank you for having me today.
Tell us what kind of opportunities that BMG gives patients with oncology issues.
Well, over the last 2 years, BMG and the Baptist Health System have formed a formal cancer center which brings together doctors of multiple disciplines, surgeons, medical oncologists, radiation oncologists, plus many supporting staff from nursing, genetic services, physical therapy, and many others to provide an integrated program to allow complete care of the entire patient with cancer, so that individuals can now get their complete consultation and services through a unified group of physicians and colleagues, providing not only the best available cancer care, but also the support that people need when they're struck with this disease.
Now, BMG has different locations for this oncology. What are those?
Well, absolutely. We have many different sites around not just Memphis, but the entire region. We are in the process of planning and building a interdisciplinary cancer center building right on the Memphis East campus. But in addition, we have physician practices and sites all throughout the metropolitan area, both in the East Memphis area and across Bartlett down into DeSoto. Further, the Baptist Cancer Center has sites across the entire region from Jonesboro down to Oxford and Golden Triangle.
Well, our program today is about cancer screening. How important it is to have cancer screening with patients?
Well, cancer is a disease that can slowly grow and progress, and it's been clearly demonstrated for many different cancer types that doing certain examinations and tests detects those cancers at an earlier stage of the disease when treatment is more effective. The primary example that many people have even forgotten is about cancer screening is pap smear testing for cervical cancer. In the 1940s and 50s, this was a deadly disease for young women, and screening for with pap smears didn't eliminate the problem, but it completely changed the face of this problem. The same thing is true for colon cancer now. Through cancer screening with colonoscopy and with blood testing in the stool, we can dramatically reduce the rate of developing the more deadly forms of advanced colon cancer. So we will completely change the face of colon cancer.
And breast cancer?
Breast cancer is also one of those cancers where early screening helps. That early screening is primarily mammography. Mammography clearly reduces the chance for individuals of ultimately dying from breast cancer. Unfortunately, mammography is not a perfect technology, and it needs to be supplemented by physical examination with your doctor and with self-examination. And still, it's not perfect, but it is clear that doing mammograms on a regular basis, starting at age 40, reduces the chance of a woman's dying of breast cancer.
Other than colon and breast cancer, are there any other sort of routine cancer screening tests that people should have when they have their annual physical?
Well, we talked about pap testing for women. Women should be screened on a regular basis for cervical cancer. Breast, colon, and the other is prostate cancer screening with regular physical examination and PSA testing for men. Now, there's been an awful lot of controversy about PSA testing, but I think the general consensus is that men of the age when they can get more aggressive cancers, particularly Caucasian men over age 50, and African American men where prostate cancer may be occur in younger ages, and B, may be more deadly, should get screening at an earlier age.
Do you think insurance companies are starting to come around to embrace and cover these screening procedures?
Actually, yes. Most insurance companies cover screening services outside of any other programs for deductible. For example, our insurance for employees at Baptist, while we have a new high deductible plan like many people around the United States, those screening services are covered outside of those deductibles and covered for free. My wife just had a colonoscopy done, and while we're paying the high deductible for other services she had, that was 100% covered. So yes, most insurance companies understand and are covering screening services for cancer.
And I think that's very important for our viewers to understand, and because that's sometimes one of the stumbling blocks in getting these tests done is that there's a financial issue and a financial burden. So that's very important news about the insurance coverage regarding screening tests.
Absolutely.
What are some other things that's happening at BMG regarding oncology?
Well, we're doing a number of things to evaluate how care is given and improve the way care is given. Research into how we deliver cancer care is critical because the current system where patients get referred from doctor to doctor, it works well, but we can do better by integrating those services to have the doctors work much more closely in teams of doctors rather than just as individual doctors. One of our chemotherapy medical oncology doctors actually has a major national research grant specifically to study integration of cancer delivery services for people with lung cancer. Dr. Osara Giagban has a major grant from one of the most difficult agencies to get money from to specifically study this in the community setting here at Baptist. In addition, we are part of the national network of organizations conducting clinical research trials for patients with cancer to try to understand and develop better treatments. We're doing that independently, and we're also doing that in conjunction with our major academic partner, the Vanderbilt Ingram Cancer Center in Nashville.
Well, thank you so much, Dr. Edge, for being here with us today. Obviously, BMG has a lot of opportunities for patients. And again, today's program is about screening for cancer. So stay tuned, and we're going to have some other experts that we're going to talk about screening procedures as well as some patients that have gone through those procedures. This is Dr. Mark Castelaw with Health Matters. This is Health Matters. I'm Dr. Mark Castelaw. Our program today is about screening for different types of cancers, and my guest today is Dr. Paul Bierman. He's the president of BMG GI Specialist Foundation. Welcome, Dr. Bierman.
Thanks for having me.
All right, what we're talking about are screening procedures that we do to look for cancer. And of course, with you being in gastroenterology, one of the most important tests that I tell my patients when they come in to have their annual exam is make sure you get your screening colonoscopy. Tell us a little bit about the incidence of colon cancer.
Well, unfortunately, colon cancer is very common. It's the second leading cause of cancer, of deaths from cancer. Totally preventable by having a colonoscopy. So we're very much encouraging people to come in and have their screenings done.
Now, that's a great question. People ask all the time, when do you get a colonoscopy? What age and what risk factors would make you get one?
Sure. Well, if you're having no symptoms and you have no family history of colon cancer, the recommendation is to come in at age 50. However, recently they've lowered that to age 45 for blacks and Hispanics.
Now, what about if you have colon cancer in your family? Is there any kind of formula of when they get colon cancer to when you get the test?
Sure, we recommend that if you have a first-degree relative, a mother or father, brother, sister, aunts and uncles with colon cancer, that you should have your colonoscopy done 10 years before they were diagnosed. So for instance, if your mother, God forbid, had colon cancer at age 52, at age 42 you should have your screening colonoscopy.
Now, Dr. Bierman, what are some of the warning signs of colon cancer? Now, the emphasis of today's show is talking about screening, just when you're not really having any symptoms, but it's time, as Dr. Bierman said, to get your colonoscopy at age 50 or whatever. But what if you're not 50 years old and you start having particular symptoms that warrant a colonoscopy? What are those symptoms?
Well, the symptoms that are most common is intermittent rectal bleeding. That's something to be mindful of. It's very easy to sometimes just pass that off as hemorrhoids, and sometimes it is. But if it's persistent and it's been going on for a while, you certainly should be checked. Other things include weight loss, changes in your bowel function. For instance, if you normally had regular bowel movements and that changed, either having too many or too little, that's important to know. Also, any change in the size and shape of your bowel movements.
So if you have any kind of change, blood or any changes in the bowel movement that's consistent, then you need to get it checked out for sure.
Absolutely.
Now, are there any things that people can do to prevent colon cancer?
There are some risk factors that we know definitely increase the chances of getting colon cancer. A big one, of course, is smoking. So if there's any way to stop smoking for many reasons, including colon cancer. Also alcohol consumption, eating a lot of red meat. And certainly it's been shown that a high fiber diet is good for your bowel function. It may even decrease the risk of getting colon cancer.
Now, you mentioned about family history, and I know that's very important when it comes to colon cancer. How does that play into your risk for colon cancer?
Well, if you have a first-degree relative who was 50 years or younger when they developed colon cancer, it triples your risk of getting colon cancer in your lifetime. So it's very important that you get checked if you have a family member with colon cancer.
In the last minute or two that we have, Dr. Bierman, what message would you give our viewers about getting a colonoscopy and not being afraid about getting one?
Right. Well, unfortunately, the most common reason I hear people don't want to have colonoscopy is because they don't know what to expect. They're afraid they'll have discomfort or it won't be a pleasant experience. And I can assure them that 99% of my patients afterwards said, I wish I knew it was this easy. Once you've had a colonoscopy and you realize that you're asleep for the procedure, it's completely painless, it only takes 15 or 20 minutes, then they no longer have that fear. And people used to also be afraid of the prep, that you have to be prepared the day before. But everything has improved so much in the last 5 years.
Well, in summary, Dr. Bierman has shared with us that not to be afraid of colonoscopies, to get it done, because you'd certainly be more afraid of getting cancer. And then lastly is this very interesting information about insurance coverage for screening colonoscopy. So folks, y'all really don't have a reason not to get a colonoscopy if it's indicated for you. So thank you, Dr. Bierman, for being with us today.
My pleasure. Thanks for having me.
You're watching Health Matters, and I'm Dr. Mark Castelaw. Our program this month, we're talking about screening procedures for different types of cancers. And as we do on Health Matters, not only do we want to get the opinions of experts, but we want to get patients on the show that will tell us what they went through, what they experienced, and it can educate us more. But as we were talking earlier about colonoscopies, how important it is to get a colonoscopy. In fact, when I got my colonoscopy, I did it with my wife. And so my children said, what a great Christmas card that would be. But it's important to get your colonoscopy. And today, our guest is Tammy Allen. And Tammy Allen had an experience that she's going to share with us. Tammy, tell me what kind of symptoms that you were having that prompted you to go see Dr. Bierman.
Well, first of all, I waited, and that was a financial issue at that time. But I started having some rectal bleeding, played it off as hemorrhoids. I was a nurse. I was on my feet 12 hours a day. I knew I had hemorrhoids, and So I figured it was hemorrhoids, and then the bowel movements started changing, and I started going more, and then some were pure blood. At that point, I knew to get to Dr. Bierman to get screened, and he found the cancer.
Tammy just said that, as Dr. Bierman said earlier, seeing blood in your stool and changes in your stool habits should warrant you to go get checked. And that's exactly what Tammy did. So Tammy, you went to see Dr. Bierman and he found that you had a malignancy.
Yes, it was advanced enough to where he didn't even have to have the biopsy to know.
He knew that you had
Yes,
it.
because
So,
I had weight loss also that I blew off, just weight loss, the bleeding, and I just blew it off because I was 40.
right, didn't think it was important, which it turned out
Right.
to be. But subsequently, then you have had surgery
Yes,
and you're currently cancer-free, correct?
yes, I am.
So what would you tell the viewers about if they see changes in their bowel habits or, heaven forbid, any kind of blood in the stool? What should people do?
Please go get screened, please. I mean, if I didn't get screened when I did, I would not be sitting here today. I do not believe.
The experience of actually going through the colonoscopy,
Oh,
was
it's
that...
nothing. I mean,
Well, say that again, because
it's
people need to
nothing.
hear that.
It's nothing. I mean, you really literally, the worst is the prep. It lasts for 15 minutes, but what's worse, prep or death?
Right. What a great idea that just going through a colonoscopy prep isn't near as bad as going through what Miss Allen went through. Well, thank you so much for being with us today. And this is Dr. Mark Castelaw with Health Matters. Thank you for joining us on Health Matters. I'm Dr. Mark Castelaw. Our program this month has been about screening for different type of cancers. We've talked about colon cancers and colonoscopy, and we're talking about mammography and breast cancer. My two guests next are patients that have undergone both testing, and we're going to discuss that. Carol Light is our first guest. How are you doing, Miss Light?
I'm fine, thank you.
And Miss Welbrock is our guest. Now, before we get into the mammography questions, I wanted to emphasize a point with Carol. Carol's had a colonoscopy, but Carol, tell us why you got that.
Well, I was prompted to get that because one of my dear friends did pass away from colon cancer, and I always felt that if she had got the screening earlier, that would not have happened. So that prompted me to go ahead and have it, and I'm really glad I did.
Well, unfortunately, Carol's colonoscopy was normal, but again, you just don't want to wait too late. Please follow your doctor's recommendations about screening procedures. Now, Carol, tell us about your experiences with mammography.
Well, I've always been proactive when it comes to my health, and so I've been faithful in scheduling those screenings as I've been directed by my physician, and I'm one of the fortunate ones there also that nothing has ever shown up, but I will continue to do that. I think we women should just get it on the calendar and do it.
And stay current with that every year, whatever the recommendation is that they
Yes.
give you. Well, great. Well, Ms. Welbrock, you had a little different experience with mammography and having some breast problems. Tell us about what your experience.
Well, initially I found the lump myself, which is very important for all women to do a self-check. And I found mine actually when I was taking a shower. But the physician that I saw, the surgeon that I went to see, he checked it, and he, at that time, and so I had a mammogram done. The lump did not show up on the mammogram, but it was still there, and he just felt like there was something more to it, and so did I. And so he did a biopsy, and the biopsy showed that it was malignant, and then scheduled me for surgery.
And since then, you've had surgery and currently cancer-free?
I am cancer-free, 26 years in January.
Wonderful. What a blessing. Well, Ms. Wellbrock points out another very important method of screening for breast cancer. Doing self-examination monthly for women is very important because, as she stated, it was inconclusive with the mammogram, but because that she had a lump, the surgeon proceeded with the procedure and found that there was a malignancy. So not only is it important to have your annual mammogram, but it's also important for you to get an examination either by your doctor or even doing self-examination. So, Ms. Wellbrock, what would you tell our viewers to do as far as self-examination and mammograms?
If you have a lump, then continue to insist on something. If you feel uncomfortable that the lump is there, that the mammogram, even if it did not show it up, be progressive in your action. Make sure you see the physician. Don't wait. Because of my going right away, I was very successful. The malignancy was taken care of, and I've been very well since.
Well, as Ms. Wellbrock pointed out, on most mammography reports, it does say that with mammograms, if you have a palpable mass or a lump that you can feel, kind of regardless about what the mammogram shows, you need to see your doctor, get it checked, and make sure it's not anything of significance. So thank you all for being with us. And again, we need to encourage women to get their annual mammogram. Thank you for staying with us. This is Health Matters. I'm Dr. Mark Castelaw. Today's program has been about cancer screening, and my next guest is Dr. Lindy Vanderwald. She is a breast cancer surgeon at BMG, and we're going to talk to her about screening procedures done for breast cancer as well as treatment options that we have. Welcome, Dr. Vanderwald.
Thank you for having me.
Now, I understand that 1 in 8 women will suffer with breast cancer.
Yes, it's a staggering statistic. 1 in 8 women will go on to get breast cancer, and many of those women are what we call sporadic cases, women without a family history or without a risk factor, but just being a woman puts each one of us at risk for breast cancer. That's why every woman really needs to take control of their own breast cancer screening. And if you're over the age of 40, that means getting a breast exam every year with your physician or an OBGYN, either an internist or OBGYN, and getting an annual mammogram.
And one thing that you said is very important, and it really was important to one of our guests regarding breast cancer, and that is not only to get a mammogram, but also to have an exam done by a physician. But what about women, recommendations about self-breast examinations?
At this time, we recommend a self-breast awareness. Some women don't feel comfortable performing a formal exam, but each woman should really be familiar with their breast, the appearance of the skin, what their breasts feel like at different times of their menses, if they're still having their menstrual cycle, so that if there is a new finding, they can present that immediately to their physician. While mammography detects many breast cancers, there are a few cancers that sometimes are not seen clearly on the screening mammogram, and those are the women that would benefit greatly from a self-breast exam and then bringing that to the attention of their physician.
Now, you had mentioned about getting mammograms at age 40. What are the current guidelines of when women should get mammograms, and are there any instances where you should get it before you're 40?
There are different guidelines from different national groups. Most commonly in the oncology world, we do recommend starting screening at 40, as that's when the risk of breast cancer starts increasing as women get older. Some women would recommend going earlier than 40 if there's a strong family history, perhaps, of women with a young incident breast cancer. So certainly if that would be a personal discussion with your physician. If you or someone has a strong family history of young breast cancers, then you would perhaps consider beginning earlier.
Now, getting the diagnosis of any kind of cancer, and especially breast cancer, is devastating, but once you're given that diagnosis, what are the treatment options that are available?
Well, breast cancer is a very exciting field in that there's so many advances and large-scale trials that have been performed. So we know a lot about breast cancer, and it's very curable and very survivable, especially when found early and detected early.
What are a couple of the options that we have?
Sure. So surgically, often most women will have the breast cancer removed initially, and many women are candidates for lumpectomy, breast conserving surgery, where we just remove the lump alone, and that's usually followed with radiation treatment. Other option would be mastectomy, which some women choose or are better candidates for, and with today's technologies that can often be done with reconstruction, and we work closely with plastic surgeons to facilitate that. And then as we've learned more about cancer, the cancer medications have become more targeted, and each breast cancer is divided into multiple subtypes with different medications that are recommended by a medical oncologist to follow. Sometimes just a pill by mouth, whereas some women would benefit with chemotherapy.
I'd like to mention one thing that oftentimes is overlooked, but men can get breast cancer as well. What are some signs or symptoms that men should look for?
They are the same symptoms that a woman would look for. 1 in 100 breast cancers will be in a man. They should look for, if you feel a lump. In men, most of the breast tissue will be right under the nipple, so that's often where we'll feel a new lump, but anywhere on the chest wall. Nipple discharge is a rare but is a indication of a possible cancer and should be looked at more closely. And then changes on the skin, dimpling of the skin, thickening of the skin, or scaly rash.
Well, thank you so much for being with us. And again, our emphasis is try to eliminate any type of fear that people have about getting cancer screening. And I think after Dr. Vanderwall's excellent explanation that this is something not to be afraid of, but something to embrace to prevent you from having the sequelae of breast cancer. Thank you for watching Health Matters today. I'm Dr. Mark Castelaw. We've learned today about cancer screening. We've learned about colon cancer screening with colonoscopies. We've learned about breast cancer screening with mammography and self-exams and having your physical exam done. And all of this is to educate you and try to relieve the anxiety that you might have about getting these procedures done. So please get your cancer screening done because it can literally save your life. I'd like to thank Jim Boswell, Claire Hick, the staff here at Channel 18, and Tommy Warren for making this program possible. I want you to join us next month because we're going to give you more information that could really save your life. Now, this is Dr. Mark Castelaw with BMG telling you that your health matters. So join us next time.
WYPL TV 18 presents Health Matters with Dr. Mark Castelaw, sponsored by Baptist Medical Group. BMG is our area's leading multi-specialty physician practice, with more than 500 physicians representing 40 specialties in the Mid-South. They provide a comprehensive range of care for all ages. Whether you need a family doctor, a pediatrician, heart surgeon, or cancer care, BMG gives you access to the most trusted doctors and nurses in our region. More information on Baptist Medical Group can be found online at www.baptistdoctors.org or at 901-227-DOCS to determine the best provider for your healthcare needs. Baptist Medical Group. Get better.